You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emran, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emran. We have a returning guest with us again to talk about another patient, so I'll let him introduce himself.
My name is Faaiz, and thank you, Dr. Imran, for having me again on the show. It was a pleasure last time.
Yeah, very good. Well, thank you for coming back again. And for those of you who don't know Faaiz, he is one of our interns. He is a pre-medical student, and he and I have been seeing patients together for the past several months already. Now, you had a friend of yours a while back who had an injury. So tell me a little bit about his age and sort of what happened and what he was asking you about.
So we could just make up a name. We'll say Johnny. So Johnny was working out, and the workout went fine. He went back to his car, and he noticed a sharp pain in his inner thigh. And when he got back to his home, he immediately just felt it numbing, his whole leg just being numb, and he couldn't feel anything. So immediately he called a doctor to see what could possibly have been wrong.
Okay, makes sense. So how old is Johnny?
He is 18.
Okay, so he's a healthy young man.
Correct.
Has he been going to the gym in the past?
Correct.
Okay, so he's someone who's experienced. He knows sort of what to do. Was there a change to his routine, something different he did that day?
Not necessarily. He has a week-by-week routine, so it just maybe he pulled something a bit harder. He might have been 10 more pounds on like a curl or something like that, and it might have aggravated possible nerve or something like that.
Okay, makes sense. And so he's someone who's experienced, and he was kind of pushing his limit a little bit, kind of working through his routine. And then he had pain, you said, immediately after that session?
Correct.
Okay. And then tell me about the numbness. You mentioned a little bit about that.
Yeah, so he said he was numb from his inner thigh all the way down to about his ankle, even his foot kind of. Okay. But it was weird because he was still able to walk, and he didn't necessarily have any sharp pains or anything that one would experience, possibly with like a stretch of a nerve or something like that. But he was able to walk fine, and he wasn't in any immediate pain.
Okay, makes sense. So let me stop for a moment, and then we're going to break that down a little bit further. So I'm glad you mentioned it in those terms. So in the human body, there are different nerves that provide different functions. So there are sensory nerves, which provide sensation. So when you touch something that's soft or hard, you know it because the sensory nerves are working. There's also nerves for vibration. So for example, when you're driving in your car and you feel that vibration, that's because of those specific types of nerves working. And then there's nerves for temperature. So when you touch something hot or cold, the body has reflexes that protect you from harming yourself, especially if it's very, very hot. So those are three types of sensory nerves. Now, then there are motor nerves. So motor nerves are responsible for actual movement. So they're the ones that move bones and muscles and ligaments. And so it sounds like in this case, your friend, his motor nerves were fine, but it was the sensory nerves that were injured.
Correct.
Okay, very good. Now, this was about several weeks ago. So he ended up seeing his doctor. And did he have an X-ray or an MRI that was performed?
He had an MRI performed.
Okay. And what did they find on the MRI?
So they found out that he is actually suffering from something called sciatica. The sciatic nerve is actually a part of the spine, part of the lumbar area, which is the lower part of your spine. So the sciatic nerve is one of the biggest nerves that connects all the way down into your thigh, into your calf as well. So because he hurt this nerve, it caused the numbing throughout the whole leg.
Okay, excellent. Very good. So the sciatic nerve is one of the largest nerves in the human body. And for reference, it's as big as your thumb. So it's a bundle, and it comes off the tailbone area. So if you kind of check back in your tailbone area, you'll feel all the bones that are there. There's a left sciatic nerve and a right sciatic nerve. So oftentimes when people have an injury to the sciatic nerve, the symptoms are only on one leg. So it's rare to have it on both legs. It's usually going to be one leg. And as we talked about earlier, the sensation nerves in this case were the ones that were primarily affected. Maybe he was limping a little bit, so maybe some of the motor nerves were also affected, but this sounds like classic sciatica, unfortunately. Now, the nerve with the sciatic nerve, it goes all the way from the tailbone, through the hip, down the thigh, through the ankle and all the way down to the ankle and even to the toes. So any part of the leg can be affected. Some people have localized symptoms, but oftentimes people come in, they say their whole leg is painful, and we know it's not a bone because there's not one bone that's that big, and we know it's not a muscle because it's not one muscle that's that large, but it's the sciatic nerve, unfortunately. Now, did they offer him treatment like physical therapy or some other medications? It sounds like they may have, probably start with physical therapy. And then oftentimes they'll offer an injection. So steroids actually are very effective. So either a shot of cortisone, we use Decadron or Solumedrol, it calms down the swelling. So in most cases of sciatica, it's inflammation. It's just very, very swollen. So once we calm it down, things actually start to get better very quickly. Now, other people may need things like muscle relaxers. Even though it's not a muscle problem, they feel like they have so much spasm. It's very, very tight. So to relax them, we offer them muscle relaxers, and that also helps them to sleep. And then sometimes they'll need painkillers, like codeine or hydrocodone, which are pretty strong. We try to avoid those whenever possible because they are habit-forming, but oftentimes steroids, anti-inflammatories, things like ibuprofen, naproxen, they actually do a very, very good job. Now, the problem with the sciatic nerve is that it can get affected again. So whenever your friend starts to go back to the gym, he may have to change his routine. He may have to strengthen his lower back muscles or his quads or his hamstring muscles because he may have done something just a little bit off. And because he's lifting so much weight, I think it would actually put him at high risk. So oftentimes we'll refer those types of people to physical therapy, but also to sports medicine. So sports medicine doctors and sports medicine therapists, they focus on athletes. So if your friend, he's young, he's healthy, and he wants to continue doing that, I strongly recommend that he talks to a sports medicine doctor, and hopefully that'll prevent the problems in the future.
Yes.
Do you have questions or other thoughts about the sciatic nerve? Oh, and I think you had mentioned earlier the possibility of surgery. So you had asked about whether this is the same as a herniated disc or if it's something that needs surgery. Unfortunately, those are case by case. So a majority of cases, probably 80 to 90%, just need regular treatment in the office, monitoring, things like that, so they can hopefully avoid surgery. But if there are situations where they have a pinched nerve and the bones are too close together, that's going to get worse over time. So even if they're young, if they're in their 20s or 30s, and the symptoms become so severe, then they really have to think about surgery. But surgery is always a last resort because it's invasive. There's always the possibility of complications. There's extensive rehabilitation. So we oftentimes get a consultation with a neurosurgeon, but we usually use surgery as a last resort, especially in people who are otherwise healthy. So thank you so much, Faaiz, for joining me on today's episode, and hopefully you'll be back again soon. Do you have any final thoughts for us, Faaiz, before we end the episode?
Well, so be very careful when you're working out. If you notice a pain like that, you want to see a doctor very quickly, as a sciatica disease or illness could be very hurtful.
Exactly.
In the long run.
No, I agree with you. So these are the cases where you don't want to ignore it. So with the sciatic nerve, some people do home remedies for it, but if it keeps happening over and over again, you're right. It's better just to come in, be seen, get the treatment, and you'll feel so much better. And that way you won't hopefully miss too much work or school. So I agree with your advice. I think people should come in to see their doctor anytime they have concerns about their back or any type of sciatica issues. So thank you again so much for joining me on today's episode. If you have questions about sciatica, or if you have other questions in general that you want us to answer, visit our website, simplehealthradio.com, and you can send those in to us on social media, or you can also email them to me. So thank you so much for being on today's episode, and we'll have you back again on a future time.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.